Greeting, ladies and gentlemen. My name is Lucas Piason. I am a fifth-year medical student from Marianno School of Medicine and Public Health and a researcher from Pelvic Floor Care Center Research Group. And on behalf of my colleagues and I would like to break down our abstract as follows. Non-ablative radiofrequency improves hemodynamic parameters in patients with erectile dysfunction. Preliminary data. These are the authors of this study, and all of them are from the Pelvic Floor Care Center Research Group. Our disclosures, disclosures, Ibramed company has funded this research, and to attend this presentation, I'm self-funded. Our hypothesis is that radio frequency can raise penile blood flow, improving hemodynamic parameters, enhancing erection quality. The main objective of this study is to observe the radio frequency of hemodynamic parameters in men with erectile dysfunction. In our methods, the inclusion criteria was men with age between 30 and 80 years old with erectile dysfunction complaints. By the way, the exclusion criteria was history of neurological disease, diabetes mellitus, Peyronie's disease, psychiatric disease, genital anatomical malformation, and premature ejaculation. The patients underwent 8 sections of non-ablative radiofrequency at 41 degrees Celsius for 2 minutes using the Ibramed Neotech equipment. The outcome erection function was assessed by the International Index of Erectile Function 5, the IIEF-5, applied previously and after the procedure. In addition, the hemodynamic data such as systolic velocity, peak, and diastolic velocity were collected in the right cavernous artery and left cavernous artery by Doppler ultrasound of penis. In our results, this study shows preliminary data from 2 patients. And as we can see, we have the first patient MAOV and the second one WRPF. In the last line, we have the IIEF score assessed before the 8-week procedure and after the 8-week procedure. And the first patient 11 points in this scale. And after the 8-week procedure, he graded 25 points in this same scale. And the second patient had 7 points before the procedure and 8 points after the procedure. And besides the erectile function, when we see the hemodynamic parameters, the first patient had 41 centimeter per second peak systolic velocity in the right artery before the procedure and 43 centimeter per second in the same artery after the 8-week procedure. And by the diastolic velocity in the same artery, the right artery, he had 15 centimeters per second before the procedure and 8 centimeters per second after the procedure. So this is just an example. We can see all this data in this table. So as a result, as we can see in the results, both patients showed improvement in hemodynamic values after the application of 8 sections of non-ablative radiofrequency mainly in the end diastolic velocity, where values below 5 centimeters per second were reached. Consider the cutoff point to exclude veno-occlusive disease. The formation. We suggest that the formation of collagen provided by ionic movement seems to work better in patients who have occlusive venous erectile dysfunction, values confirmed by an increase of the IIEF5 score. So, as a conclusion, radiofrequency treatment suggested an improvement in hemodynamic parameters of the erectile dysfunction based on the results evidenced in the patients included in this study. Thus, there are few data in the literature on such treatment in cases of erectile dysfunction, which requires a better scientific basis for the adequation of treatment for these patients. And also, radiofrequency treatment can be a therapeutic alternative for this population. These were our references. And to round up, I'd like to thank the scientific committee for affording my colleagues and I this unique and priceless opportunity to air some of our views to you. Thank you and God bless.